Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today's Thursday, June 24th, giving you the update from Albany Med. All right, Fred, we were not here Tuesday.
Right.
People were not happy.
I know, sorry about that.
That's my fault.
Yeah,
My fault.
Both of us.
Okay. First graph, let's take a look at the entire state first and see where we're at as far as people in the hospital with COVID. It's down to 474. It's come down quite a way from 18,000.
Yeah, absolutely, Dennis.
Next graph is capital region, and we're currently at 17 throughout the entire capital region. Next graph here is a run chart, really, which goes all the way back to the beginning of the pandemic. And we're looking at admissions and discharges. Now, Fred, we had some fun with this the other day. We did it. We did a 7-day run.
Right.
And we asked what the binary definition of that was. I think, who was the first one to answer it?
Matt Cerf was the first to answer it, and he said it is lowercase f.
Lowercase f. All right, so I forget what the run was the last 7 days, but here's the last 7 days now. So in the last 7 days, 0, 0, 0, 1, 0, 0, 1. And of course, I know we can Google this, but it's more fun for have other people do it.
So the question is, how quickly will one of us get a message about what that means?
But what it really means is in the last 7 days, we've had two admissions.
That's what it really
with COVID.
means.
So that's
Absolutely.
great news. So what that means as far as the medical center this morning is that we've reached a new milestone, which is that we can now count the number of people in the hospital with COVID on one hand. So yeah, so it's 4. Right?
4.
4. So what's the breakdown on the 4?
So Dennis, there are 2 intensive care patients, 1 on a ventilator. Of the 4, only 2 are actively being treated for COVID.
Wow.
The other 2 are not infectious.
Okay, so that's come a long way from 165.
It's amazing.
Okay,
it's
very
amazing.
Good. And so let's talk about one of the reasons why we're there, which is vaccines. Here's the current numbers in the capital region on vaccines. 674,000 have received at least one dose of vaccine. Fred, when you look at the total population and you say how many have completed the series, it's 57.4%. So that's about 5 or 6 percentage points better than the state average.
That's great.
And we know New York State's actually one of the better states in the country when it comes to vaccine. If you look at the population 18 and older, we're actually at 67.7%, which is really in that herd immunity range, close to it. And here's some really fun numbers. If you look at it by age group, if you look at those 65 to 74 in the capital region, 92.7% have been vaccinated.
It's incredible.
And 75 and above is 86.7%. Incredible numbers. Is for
So those age groups clearly are in that herd immunity.
No question about it.
Territory.
No question about it. So Fred, let's take the vaccine story, and there's really 3 sub-stories that we want to dive into.
Yes.
Let's hop on a plane and let's fly to Scotland. And now there's an article that was published in Lancet that you've read, and you think there's some interesting information in there.
That's right, Dennis. So in Scotland, they actually have created a database, and they capture health care data on 99% of their population of 5.4 million people. And they've been tracking COVID activity in this database. So they've actually published last week this. They've looked at the efficacy, how successful the vaccine is in the Alpha variant, which is the UK variant that we used to talk about, versus the Delta variant, which is the new one, which we know is more infectious than even the Alpha variant. And for Pfizer, which is available in this country as a vaccine, it's 92% effective in the Alpha variant and 79% effective in the Delta variant. And those are probably not statistically significantly different. I think the message is that the vaccine works against the Delta variant, which is growing in the United States. I think it's now at 20% of the identified virus out there.
So if someone was to say, oh, but I heard you say that it's only 70 some odd percent versus 90%, you would still say that's still effective as far as a vaccine?
Oh, absolutely, Dennis. And you know, in a study like this, it's hard to say that 92 versus 79 is really different.
Okay, excellent. Good news there.
Yeah.
Also has been reported in the news recently that with Pfizer and Moderna, they're talking about whether or not there's any association between that and whether or not there's the development of something called myocarditis in an adolescent patient population. So let's talk about that. First of all, Fred, you're a cardiologist. We've talked about that. What is myocarditis?
So Dennis, myocarditis is an inflammation of the heart.
Okay.
It can be caused by lots of different things, by chemicals, by infections, by viruses, and it can be very mild or very severe.
Okay, excellent. And we know that anybody who's in the business of giving vaccines has to watch the people that they give the vaccines to.
Yes.
And if there's adverse side effects, they are required to put into a database called VAERS, Vaccine Adverse Event Reporting System,
Yes.
those things. So we are looking at right now whether or not there's any association between vaccine, that population we're talking about, and myocarditis. We have some preliminary look. We're looking at it closer, and we think we'll be able to come back next week with something on that.
Yeah, this is something that the CDC and the FDA are looking at. There's some new information coming out, and so we'll talk about this on Tuesday and go into a little bit of detail.
Okay, excellent. Last topic on vaccines. So this is a great topic for a couple different reasons. Fred, you and I have talked about whether or not, as we increased vaccines in the populations we talked about, we're talking about 93% in that age group, I think it was 65 to 74.
Right, the older age population.
Right. Has that changed in any way the age of people who get COVID and come into the hospital?
Yes.
We speculated on that.
We did.
And then there was somebody who works at Albany Medical Center on the list of, again, my favorite people, Dr. Megan Keenan, who's a director in our quality management department, who actually then went and looked at the data and gave us some graphs. And Fred, tell us what she found.
That's right. So here's the first graph. Let's pop this up. This is from the beginning of the pandemic back in March of last year through just about the end of December, just before we started vaccinating people. And what you have is the age of people admitted here in the hospital. And that solid line that goes across that really doesn't change is the trend line. Okay, and it's at about 60 years of age, and it doesn't really change.
And these were people who came into Albany Med with COVID.
With COVID, admitted to Albany Med. So now let's pop up the second graph. And what you can see here is that same analysis, so the age and the trend line from the beginning of vaccinations all the way through the present.
Changed.
And it changed. The slope of that line is down. So the average age of people admitted with COVID here at the medical center from the end of December when we started vaccinations through just last week declined by almost 13 years from 62 to 49 and a half.
Right.
And Dennis, why is that?
Well, I think it's because it's pretty obvious because the first people we rolled the vaccine out were in the older age group, and so they were protected immediately. The virus started to move to the younger population. Now, of course, the denominator is getting smaller too. The number of people coming in is less, but certainly the age is also dropping. And it really, I think, is just another example of the vaccine works.
Absolutely.
And you can see it in that graph there.
Absolutely. The orange bars actually are the number of admissions, and that illustrates the point you made about the declining admissions.
So thank you to Dr. Keenan for pulling that data together for us. And it's another example of where the data really is pretty fascinating.
Yes, it really is.
So talk about data, talk about fascinating. Length of stay, we're seeing some great progress there as well.
We are. So let's pop up that slide. And you can see that, again, the dotted line is total length of stay. The solid line is absent the COVID population.
And they're really
coming together.
Yeah.
And they're in the 5.7 range in that neighborhood. As a matter of fact, today we heard at Safety Brief 5.59.
Right.
We're moving in the right direction. But again, we sound like a broken record about this, but length of stay is so important. It's important for our patients, get them home or to the next venue of care that they need as quickly as is reasonable and free up that bed for people who need it. Coming into our organization.
I mean, even if we were to reduce length of stay by another quarter day, what that would really mean is in a day where we might bring 100 people into the hospital, you'd free up 25 beds.
That's right.
Now, we admit even more than that, so the benefit would be even greater than that.
That's right.
So that's something we're keeping a very close eye on. Fred, the workforce has asked us to take a look at whether or not it's possible to access the fitness center on more hours.
That's right.
We have a 24/7 workforce. We have people who may be not able to get there during the traditional hours of the fitness center. So a bunch of people looked at this, including the folks who run the fitness center and the hospital and security. and others. And I think there's some good news to announce.
So next week, I think July 1st, we're going to open up the fitness center 24/7. So
Right.
it'll be open around the clock. Now, we want to be safe about
Right.
this. So the fitness center is on the 8th floor of 50 New Scotland. It's out of the mainstream. So, you know, during the day, there are people there, there are trainers there, et cetera. Off hours, there won't be. So we're going to do a few things. You'll have to sign attestation if you want to use it. You'll swipe in, and that swipe will alert security to let them know that there's somebody there. And security will then incorporate rounding through the fitness center just to check on people. We're ultimately going to use some technology to make it safe as well. We're probably going to put some video cameras in there. We've talked about devices that people can take and could you know, press a button, sort of a panic button. So more to come on those technology changes, but it's going to open next week.
Again, to people, members of our workforce who are members of the fitness center,
Right.
and you know, honestly, I think it's $5 per pay period.
Yes.
So many have taken advantage of that. While not a requirement, might be a good idea if you're going to go over there off hours. Maybe go along with a
Go with a buddy.
Go with a training buddy.
Yeah,
You and I
yeah.
can go over.
Sure.
I'll do the bike. You can do the treadmill.
I'll watch you.
Last topic is town hall. We've had a series of town halls. I think we've had 4 of them now. And if you have not been able to attend the town hall, we have a video of that. It runs about 50 minutes, and it's available on the intranet. And in order to make ourselves available to our weekend team and family here, we're going to do one this Sunday morning at 7 a.m. So watch for that. Probably in the same location, but we'll post that on the intranet.
A lot of good information.
They're great.
Dr. McKenna provides to everyone.
And we get great questions.
Yeah, absolutely.
All right, so we will be back next Tuesday. We said that last time, but
I know.
we'll
We'll
back.
definitely be
We'll
back on Tuesday.
All right, have a great weekend to those who are going to be able to enjoy it. To those who are working here, we thank you very much for everything you do. We ask that you once again please take care of yourself, take care of each other, and we'll see you next week.